My name's Kate Wills and I'm a psychiatrist. And the world is really fast paced now. And what I've really noticed is that being busy is almost worn as a badge of honour. The pandemic, though, really changed this story. And now burnout is higher in Australia than global rates. So people are turning to the wellness industry to help manage this. However, it's really an unregulated space and there's not much evidence to support these approaches. So I'm really passionate about early intervention to prevent burnout becoming chronic and potentially developing into other problems like mental health issues or addictions. When I was going through medical training, I had 3 young children and the culture in medicine was brutal. So the expectation was to give everything that you have, regardless of family commitments or outside interests. And towards the end of my training, I developed what I would now consider burnout after I received some negative feedback. When I was really giving all that I had, I actually wasn't my best self at work and I ended up taking a couple of weeks off to recalibrate, and that was my turning point. So I came to medicine with a previous life and I look at the system differently. So I really want to see early intervention and prevention approaches to well-being, but the system approaches health from a kind of band-aid or reactive perspective. So I have found a novel way to support people with burnout by using a loophole in the system. And I developed an evidence-based approaches and holistic online course to help lots of people to get fundamental strategies for physical, emotional health, as well as cognitive values. I really want everyone to have access to care, to see preventative treatments prescribed by their doctor. When I lived in Europe, I saw doctors could prescribe health retreat treatments for conditions like prolonged stress or burnout, nervous exhaustion, migraines, or even, perimenopause or parenting stress. And that sort of thing isn't available in Australia. So I developed an evidence-based online course for Australia, and my aim is to have this program available nationally. And in order to provide access to the community, this would also be available in private hospitals and therefore rebated through private health insurance. So I've found an innovative way to make this possible, and I'm actually grateful to St John of God Hospital because we've had our first pilot program there, and now I'd like to really roll it out across Australia, and I'm in talks with like Ramsay Group at the moment to do exactly that.